Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about direct primary care. Direct primary care is something that has been up and coming over the last probably 8 to 10 years, and it's still not widely understood or known about. Direct primary care is, as it says in its title, for primary care providers only, but that doesn't mean that specialists and ancillary providers shouldn't know about it, because there is a possibility you could be seeing patients who have a primary care provider that practices this type of medicine. Direct primary care is recognized by the American Academy of Family Physicians, as well as pediatric foundations, or the equivalent of the American Academy of Family Physicians. And it's also recognized by the Affordable Care Act information that's out there. Direct primary care is basically eliminating any kind of third-party billing or insurances when treating patients and receiving payment. It's basically having plans or subscriptions that patients would sign up for, and you either bill the patient monthly, half a year, or a full year annually, and it's for pretty much full access to your clinic. So if a provider who offers primary care services is a direct primary care physician or provider, it means that they do not bill insurances at all. They won't bill co-ops at all. Literally, the money that they make is coming from a patient's out-of-pocket subscription fee that is including everything for preventive, routine, sick visits, basic labs, even maybe some medications that they have in office that they can give, like antibiotics or prednisone, maybe something very simple to treat. Usually it's very affordable, so we're saying like less than $100 a month per person, and it includes telehealth visits, even sometimes providers going to people's homes if they need to, having prompt same-day appointments available for them, being available by phone when needed. And it's really not to only help people who can, quote, afford it in the sense of having a higher income. It's supposed to help include people who are on fixed incomes, like the elderly, and also to help parents with children who maybe, it's their first child and they're a little hypersensitive or nervous, hypochondriac type situation, because that happens a lot with first parents with their first children. And it gives peace of mind. It also could make it more affordable as far as trying to afford health care and stay healthy and do preventive services versus paying a huge amount in premiums a month to cover your entire family. Because there's no contracts with insurances, these direct primary care clinics don't have to follow those standard regulatory and compliance instructions that they would need to if they were contracted with an insurance. Like, there's no strings attached. They don't have to worry about, violating some kind of fees or charges. They don't have to follow MACRA and MIPS, so they're not getting credit and incentive payments from insurances and the government, but at the same time, they're being able to spend more time and focus on their actual patients than having to worry about coding and billing and documentation and making sure that they're, dotting all their I's and crossing all their T's. They're able to have longer appointments with their patients, more face-to-face time, which we have gone away from hugely in medicine over the last 15, 20 years, because doctors are so inundated with making sure that they're seeing enough patients to cover overheads, to also make sure that they're documenting correctly and coding correctly, and making sure that they're going to hit all of those requirements when it comes to all of those measurements, that we're losing the focus of what medicine's really about, and that is treating patients. Also, with direct primary care, you want your patients to be healthy. You don't want them to need you, right? You don't want to keep your patients sick. You get rewarded for having less patients on your schedule every day than if you are billing insurances, because you bill insurances based on need for people being sick. people being chronically ill with conditions that maybe can't be cured or are hard to cure, where it's an advantage to you to keep your patients healthy because you're only charging a flat fee for all your services. And so if they're being seen multiple times a month and it ends up costing you more, quote, out of pocket than what they paid, you're losing money. So the incentive really is to keep patients healthy, focus on that preventive stuff, and also making sure you have more control over your patient's follow through on doing things, right? Like if you notice that a patient didn't have their labs done, if you're billing an insurance company like a standard practice, maybe you don't draw blood in your office or you give them orders to go elsewhere because they didn't fast that day. And then unfortunately, because you're so busy, your staff gets busy, you forget to track that. Or by the time you track it, it's, a few months down the road and you're like, oh, I realized they never got their labs done. Where if you're doing it in-house, a lot of times these direct primary care practices will have some kind of deal with the local lab that would do the processing if they can't do the labs in-house, which there are so many labs anymore that can be done in-house and are CLIA waived that it's wonderful for primary care, especially for this direct primary care situation. But anyway, if you had to send it to a lab, you would get some kind of discount and they're billing you and you're paying for it because it's all included in that cost that you are billing that patient every month. And the charges don't change. So if a patient signs up and it's $40 a month, they pay you that $40. That's going to include their labs. It's going to include any imaging you might do in-house. It's going to include, like I said, any kind of medications, like maybe they keep a pharmacy on hand of basic meds like hypertensive medications, diabetic medications, antibiotics, just the basic stuff so that they can provide it to you and it's included in that cost as well. This is so good for people who want that old school feel of having that personal relationship with their providers. And it is not discouraged by any means for patients to still hold some kind of insurance because it does not cover specialists. It does not cover hospitalizations or any kind of huge catastrophic thing that might, God forbid, happen, like a motor vehicle accident or something that puts you in a hospital and need a major surgery or something like that. It's only for primary care. But people can more affordably carry possibly a high deductible plan for those catastrophic situations or seeing a specialist or whatnot, and still be able to afford that direct primary care subscription. And then they have all bases covered. They have a really good relationship with their primary care. Hopefully they're getting top-notch care, which is the goal always. And they are staying healthy. And then if they need to, they can see a specialist and have it billed to insurance with that additional coverage that they have. Direct primary care is growing. It's hard to find them in your area. Usually you have to go by word of mouth, which if someone's referring their direct primary care doctor to you, chances are they're really good because that's like the highest form of flattery, right? Like the best form of marketing is word of mouth. So if somebody's referring them to you, chances are they're really good. They might have a large panel of patients. They might have like 500, 800, 1,000 patients. But again, they're trying to keep people healthy. So there isn't a huge wait when you go to see them. It's easy to get in same day or next day if you do need them for an acute need. You can call them and do telehealth because like 80% of visits can be done via phone or telehealth. They don't need hands-on. So it takes advantage of that and more convenience. It allows doctors and providers in primary care to see less patients a day and not have burnout and to enjoy their job for the reasons that they got into medicine for the first reason. And it also allows not overwhelming, just full waiting rooms, right? Because you go to their primary care, they're cattling you in and out every 15 minutes. That's as much time as maybe you get to see the provider face to face. And there's all these people in the waiting room where direct primary care, their goal is to have that different. And I think if you were to experience direct primary care and you've been going to see a doctor long enough, you're old enough to remember, kind of quote, the old school way of medicine, as I like to put it, it's more appreciated and it's getting back to the roots of what healthcare and medicine is all about. So anyway, It is an option if you're thinking about opening your own primary care office, direct primary care. It's definitely recognized, it's definitely supported. There are resources out there, and it is something that you could totally consider if you don't want to deal with billing insurance companies and hitting metrics and MACRA and MIPS and all of that fun stuff. If you have any questions or comments about this, please leave that in the comments below. I encourage you, if you are a direct primary care provider or you work in a direct primary care office or have experience, please leave your experience and encouragements or some disadvantages even that you want people to be aware of. Not that it could, turn people away, but something that they should be aware of in the comments as well. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Thanks so much, you guys. Take care of yourselves. Stay healthy. Bye-bye.